My name is Dr. Greg Poland. I'm director of the Mayo Vaccine Research Group at the Mayo Clinic in Rochester, Minnesota, but I'm here today representing the American College of Physicians. We've heard a lot about this year's influenza pandemic, and as serious as that is, I do want to remind everybody that seasonal influenza causes an average of 36,000 to 40,000 deaths every year in the United States. I don't want to cause any conFLUsion here, but remember that 40,000 seasonal flu deaths is about the same number of deaths that the 1968 pandemic caused in the U.S. It's even possible that this will be about the same number of deaths caused by this year's pandemic influenza, but of course there's no way to predict. But ask yourself a question. Why do we panic over the prospect of 40,000 deaths in 1 year due to pandemic influenza, but basically ignore the same number of deaths that occur year after year due to seasonal influenza? Well, if you don't want a dose of vaccine, how about a dose of reality? During the average flu seasons, 1 out of every 1,200 Americans is going to end up in the hospital due to influenza, and more importantly, 1 out of every 8,300 Americans are going to die in the next coming months if this is an average flu season due to seasonal influenza. And this drum roll of deaths occurs year after year after year. These deaths cross geographic, age, racial, and socioeconomic lines, and they take our children, our parents, our grandparents, our friends, and family members from us. So I wonder, when is enough enough? We continue to minimize the consequences and hold tight to misperceptions about how deadly serious seasonal influenza really is. And predictably, over the next few months, 36,000 families are going to be mourning the loss of a loved one. When is it enough? It's important to realize that if you've seen one influenza season, you've seen one influenza season. Every season is different. George Bernard Shaw said, "If there's one thing men learn from history, it's that men never learn anything from history." I take it he was referring in general to humankind and not men specifically, but my wife thinks differently. We tend to behave and make decisions about whether to get flu vaccine based on the severity of the season we experienced in the prior year. So a mild season lulls us into complacency. And so it seems Mr. Shaw was right, at least when it comes to influenza, for we never seem to learn from history and take action in the form of prevention. The point is that we shouldn't be complacent, nor should we panic. Rather, we should be prepared, vigilant, steadfast, and proactive about protecting against all influenza strains every year. Influenza is insidious and clever and changes over time. It spreads at different rates in different regions. It can be mild 1 year and then unexpectedly deadly and severe. And it can even change within the same year. For one family, it may result in a tragedy. For another, a week out of work or school. But you cannot predict what fate it will bring when it strikes your family. I'm a practicing physician, and I've seen one tragedy after another with this disease. I've seen a young, otherwise healthy teenage boy develop influenza and have to leave school and go home, and the following morning his mother couldn't wake him up. He was dead of an influenza viral myocarditis or infection of the heart. I've seen a grandfather struggle on a ventilator for a week and finally die of influenza-related pneumonia. I've watched many friends and acquaintances miss important family events, vacations, weddings, and graduations because they were simply too ill to get out of bed. We should start, of course, as Dr. Frieden mentioned, with the man or the woman in the mirror. As a practicing physician, I ensure that my family and I get vaccinated every year. I try to protect my family's health. We don't get into a car without wearing a seatbelt, and we don't go to school or work without getting protection from an influenza vaccine. It's also very important to emphasize that all healthcare workers should receive flu vaccine. It is an embarrassing fact in this country that the majority of healthcare workers, 60% of them, do not get vaccinated. And we keep talking about that, and we keep not doing anything about that, and it's time to change. When a healthcare worker has influenza and goes to work, they have the possibility of spreading that to the patients that they are privileged to care for. And the consequences of that are tragic. So speaking to my colleagues, I want to say one important message. I'm sorry, but it's not about you. It is about the patients that you are privileged to care for, and it's about protecting them. Healthcare workers and the institutions they work for, I think, have a professional and ethical obligation to protect patients from harm. Studies have shown that vaccination of healthcare workers dramatically reduces patient mortality. Now, hear me clearly. When healthcare workers get vaccine, the death rate in the ICUs of the patients they care for drop by as much as 60%. And if the benefits to patients don't sway you, let me just emphasize that CDC and every professional society that I'm aware of at least endorses the idea that healthcare workers get an annual flu vaccine. But they are complacent about this, and as I said, the majority still do not receive vaccine. Many professional societies, healthcare institutions, and now individual states like California and New York care deeply enough about patient safety and quality of care that they have said enough is enough, and they are requiring those healthcare workers to be immunized. This, I believe, should be a priority for all healthcare institutions who take patient safety seriously. And to each of you, I would say, ask your hospital or your clinic, your doctor or your nurse, if they've gotten flu vaccine. And if they haven't, ask them why not. Myself and others have been advocating for a recommendation that all Americans be urged to get influenza vaccine. Clearly, some groups are at higher risk than others, but everybody is at some level of risk. Important benefits of flu vaccine are becoming clearer and clearer. A published study examined the impact of a universal influenza immunization recommendation in the province of Ontario. Widespread use of that vaccine led to decreased antibiotic prescriptions by 64% and a 40% decrease in influenza-related mortality. 40% decrease. So let's endorse and recommend annual universal influenza vaccination. With the increasing virulence of seasonal influenza and growing rates of antiviral resistance, it's time to do this, and the data now support moving on this important recommendation. And we have no other method as effective in preventing influenza. So the data here are very clear. Getting an influenza vaccine will reduce your chance of having to seek medical care, of being hospitalized, and of dying. In fact, influenza vaccine can reduce all-cause mortality by as much as 50%. So why gamble with your or your family's health? I want to summarize with just a few key messages. And I think, and hopefully it's clear after today, influenza can be a serious disease and lead to life-threatening complications, and for 40,000 or so Americans, death. The other point is that influenza vaccines are safe, they're effective, and they're readily available. And thirdly, I would say, ask your local hospital, clinic, doctor, nurse, and pharmacist to support requirements that healthcare workers get a flu vaccine each year to protect you and the patients that they care for. This is a patient safety issue.